Welcome to Call the Doctor, and we want to emphasize you are so welcome to call at any time. Telephone number is, that's Carolina Regional Orthopedics. Okay, 252-407-1111. And you remember Dr. Bernard Kemker? And today we have Vincent Keeney, who is a physician assistant.
Yes, ma'am.
And I've been talking to him ahead of time, folks. He is very much going to help us learn about ankles and feet and whatnot and things that I didn't know we had somebody with your degree of expertise here locally.
Well, thank you.
To do that.
Thank you very much.
I'm excited. I've got family members who have those things. I've had those things. I think most of us, because as people get older, most people are going to have something happen to their feet, aren't they? They
will. It's very, very common.
Well, and you were here with Carolina Regional Orthopedics and then left and came back, and I'm really glad we're glad he came back.
We're very glad he came back. Actually, when I started here was kind of right after Dr. Keeney left us, and all I heard about is when's Vince coming back, when's Vince coming back. All my patients were asking me about when's Vince coming back. Like, I don't know who Vince is. And now that he's back, I'm very glad that he's back. So here's magnificent Vincent Keeney.
Well, thank you very much for having me.
Well, certainly, and a physician assistant, and you told me that all of your rotations were in orthopedics, right?
Yeah, I had the opportunity of having 3 different orthopedic rotations while I was in PA school, so that really set me on fire for loving the musculoskeletal conditions and getting people back to being active, which is a lot of what we do. So depending on what's going on in your life, if you have a condition that you want to be getting better from so you can have the athletic ability or just going on a walk with your dog, that's what makes us happy, getting you healthy again.
Mm-hmm. Dr. Kemker, how do you all complement each other?
Sure, so we run a pretty advanced team. We are in constant communication. Vince and Morgan are my 2 main PAs in my office at the current moment. There's other PAs there as well, and we all kind of share patients. So first of all, open communication. Vince assists me in the OR. He assists me with call. He assists me with rounding. He works with me in the office. We go over difficult patients daily. We're just trying to continue to...
No, I want to say not difficult patients, personality-wise.
Correct.
Difficult. You're not difficult.
Patients who have difficult problems that we're trying to address, because we really try to take all comers into our clinic, try to get them better, try to keep their care close to home. That's some of the stuff that Vince is going to talk to you about today with some of the stuff that he's bringing back from his knowledge from Montana when he worked with an ankle specialist. That's kind of maybe not so relevant or prevalent around here in the past several years. So it's been a great benefit to our community and most certainly to our clinic. So.
Well, in the last 2 shows, we talked about hips and knees, which you do a great deal of. And when you told me Vince was going to come in and talk about ankles and whatnot, that would just, and you prepared, you've got a big list. Do you want to start with your list of various things that people watching might have and might really like to know there's help available?
Absolutely. So one of the things that comes in commonly, and we're going to start talking about the ankle here, is somebody that comes in and they may have stepped off of a curb wrong, and we would evaluate them, and many times we determine it's an ankle sprain. So that could be someone that's an elderly patient or just somebody that's on their way to work or into work. And so when they come in, we evaluate them for their presentation. So we would examine them, we would get an x-ray, determine that there is or is not a fracture associated with this, and then discuss how we treat an ankle sprain. And so when someone comes in and they've never had a problem with their ankle before, I try to be very conservative with the approach in the sense that we'll start with a brace of some kind. It might be a walker boot, or it could be a lace-up ankle brace that is very easy to apply, that provides some stability, some immobilization, and helps with controlling some of their pain. And that's a lot of why they're there to see me or whoever they're seeing that day.
And that's why a lot of people you hear when they sprain their ankle, like if their kid's in a soccer game or something like that, you frequently hear walk it off, I don't think it's broke, right? Don't go see the doctor, it's not broke, it's just a sprain. Why should you actually come and see someone for a sprain?
Yeah, that's a great question. So 2 reasons. It could be broke. That's probably the big one. But also, not every ankle sprain is something you should just ignore. There are some high ankle sprains that involve the actual stability of the ankle that can lead to trauma, post-traumatic issues with the ankle down the road that can lead to early arthritis, or it can lead to developing certain lesions. Like if you're a younger athlete, you might not develop arthritis right away, but you could have a defect develop in your bone because of too much instability, because the ligaments were torn during that sprain.
And unless you get an x-ray, you really don't know whether there's even a hairline fracture or something that does need extra attention, right?
Yeah, the x-rays are very helpful at us determining a broken bone, but we can also look at the x-rays to determine sometimes if there's an issue with ligaments, and we look at the spacing of the bones and kind of the relationships of each bone to one another, and that helps us pay attention to the ligaments, and that might guide us in our exam a little further.
Yeah. And those ankle ligaments, even though they're small little ligaments, they're not unimportant. They're extremely important to the way your ankle functions. And I'll be honest, I tell most of my ankle fracture patients, even when they have to have surgery, I'd say, I'd rather have your fracture than a bad ankle sprain. So whenever you have a bad ankle sprain and your ankle is big and swollen, you got to come see someone, because like Vince was saying, you need maybe a short period of immobilization. Maybe that's a cast or a boot. Physical therapy, you're probably going to need that to get your swelling down.
Absolutely.
And if you don't get your ankle sprain treated, there's stuff like complex regional pain syndrome that can actually absorb your bone in your ankle. Like there's a whole bunch of things that can happen with a simple ankle sprain.
It can absorb the bone in your ankle?
Yeah, so there's complex regional pain syndrome. You have a big injury, right?
Yep.
Your nerves go on hyperdrive and you get extravascular support. Your body's trying to heal it, and in doing so, the bone kind of reabsorbs itself a little bit. So if you have a bad ankle sprain, you absolutely got to come in and see us, right? It's frequently, it's around here, you always get the rub on dirt, you know, walk it off, it'll be okay. But if your ankle's hurting and it's not better, come in and see us right away so we can try to get you feeling better.
And the sooner you get in, the less damage that will happen, which will come back to haunt you later on even.
Yeah, early rehabilitation with therapy after an ankle sprain is important. And that is following the brief period of immobilization. But getting them to work on range of motion, work on getting those ankles stronger and to do their job of stabilizing the joint, and to work on balance again after an ankle sprain, their proprioception, you know, where they are in space and time. It's been studied that after an ankle fracture or ankle injuries, that the ability to react, even like with your driving, can be affected from going from the brake to the gas pedal, for instance.
And Carolina Regional Orthopedics has an urgent care. So as opposed to going to the emergency department for something like that, they can come, and during all of your regular office hours, you will take somebody in an urgent care situation.
That's right. We have a wonderful urgent care. It's growing, and it's a really great benefit to the community, because urgent things pop up, and it might not be something you want to wait a month or 6 weeks or 2 months for. And so I think it provides a great service for you to come on in and wait shorter than the ER, which is a benefit to the patient, and you're right where you need to be from the beginning, rather than going somewhere and then being referred to us for follow-up.
Correct.
Okay. What's next on your ankle?
Yeah, another thing I see commonly, we see Achilles tendonitis, or sometimes Achilles ruptures. Achilles tendonitis is something we see usually in an aging population. They sometimes will, maybe we would call them a weekend warrior or a weekend athlete, where they pickleballers, basketball people that go out more on the weekends, and they'll have pain in the back of their ankle. So the Achilles tendon is running from the back of the ankle there. I'm sorry, my model's probably blending into my coat, but the Achilles tendon helps with you know, their ability to push off and to dorsiflex when they're moving. Well, I guess I should back up. It would occur, the pain would occur when they're trying to dorsiflex or plant their foot.
Is that what dorsiflex means? Plant your foot?
Yeah, you're planting and then go, yes.
And rocking.
Pushing down, yes.
Pushing down, yes,
What would
ma'am.
someone know when they, when would someone call you if they think they might have one of these conditions like Achilles tendonitis? What would be the sign that they're experiencing?
The sign that they would be experiencing is simply, most oftenly, pain. Pain in the back of their ankle.
And it doesn't really go away, right?
Yeah, it's persistent. You know, they go to bed when they've had the pain, and then they wake up and the pain is still there. Usually
keeps
every
them
step.
awake, too.
And it can, yes ma'am. We treat that very commonly with physical therapy oftentimes. Sometimes it's a modification in their shoe. We don't like to inject the Achilles tendon because that can cause a rupture of the tendon itself. But during physical therapy, there are different modalities they can do. Dry needling, iontophoresis, as well as giving you a great home program, because really one of the keys to getting rid of it is stretching, and that almost seems counterintuitive because you're in so much pain to begin with.
But you need to do it under careful instructions, not just, if you're watching at home and you have this, I would no more try and figure out how to do it to myself than anything in the world, because you can make it worse.
Absolutely.
I
Yeah.
have a question.
Okay,
Oh, wonderful.
One
question.
viewer that is asking why she has stabbing pain in her ankle. They're not swollen. She said, I have stabbing pain in my ankle, and it goes away, and a week or two later, stabbing pain comes back, and it goes away.
No injury. I
No.
mean,
She said, nothing, she cannot figure out why it would be doing that. She
You wanna
said, when
repeat
it's
that
doing
before
it,
you
it's
answer.
very
So the phone conversation calling that we got was a question of a patient who's having stabbing pain in their ankle. Did they say what part of the ankle?
no.
Okay, so stabbing pain in the ankle, about severe, once or twice a week, goes away for a week and comes back. That could be a lot of things. We kind of need to know where the pain is at and if it's an activity. Number one, you got to get that checked out, because depending on your age, it could be an insufficiency fracture, and that might need an actual cast mobilization, or a degenerative like arthritis, and could really benefit
Absolutely.
from an injection.
Yeah.
Do you have any other thoughts?
Well, absolutely. It could be a tendon issue. I mean, if it's on the side of their ankle or on the inside, either side of the ankle. If it is an arthritis, we would definitely want an x-ray, or if it's an insufficiency fracture, but definitely get seen by us, come on and make an appointment for it to be evaluated by a professional.
It's an excellent question, though.
Thank you.
Thank you for calling.
Yeah, I wouldn't want to continue like that with unknown. I don't like unknown things. I'd rather know what's causing it and have somebody tell me how to
I
keep
think
it
we
from
get
getting
that very
worse.
commonly, actually, is I'm here because I want to know what's going on.
Yeah. And you told me something before we started, Vince, that I think is really important. You want us to keep what God gave us and work with that. Surgery and whatnot is the last resort, right?
Absolutely. I think the best thing you're ever going to have in your body is what you were born with. And trying to extend the natural life of that as long as we can, many times is the right thing to do. So that's why we try a lot of these conservative approaches with bracing or injections, sometimes a medication or a therapy is a great approach to that.
And y'all do have physical therapy available at Carolina Regional Orthopedics.
Correct.
The braces and stuff, you've got good referrals if people need something like a boot that you don't carry.
Many braces or many devices we already have in-house, so we
good.
can fit them for it, make sure it's the proper size and fit for their body.
You
Everybody's
mean I
made
can't
different.
just use my friends? I have to.
I probably wouldn't, but you should come in and see us for that.
And the other thing is, if you have a more advanced condition, we have good non-operative referral pools within the community too for stuff like custom orthotics, custom braces, and there are times when those are required, especially for the foot and the ankle. We have a couple that come around and see people in their homes. We have some situations where you can go see them. It's nice being private because we're able to develop these relations that sometimes you can't develop in a bigger medical center. So our patients have gotten really good benefits from that.
Good. What else do you see a lot of?
I'd say another thing that we see very frequently is an ankle fracture. And we kind of started off with ankle sprains and how if you step off of a curb, it might just be an ankle sprain. Well, the other end of that is maybe you do have an ankle fracture. And so an x-ray is very important in determining that. And then based on the type of fracture, we have a discussion. And sometimes that discussion with the patient may look like this is something that we would recommend conservative management for, meaning not surgery. And sometimes the recommendation, if the fracture, let's say, is unstable, would be for surgery.
Because if it's not fixed properly, it can bother you the rest of your life.
Yeah, it could lead to a problem that is long-lasting, such as arthritis that can develop as a result of the initial trauma. And that sometimes is avoidable to an extent, but the injury itself can often lead to you developing arthritis, but trying to minimize that extent is really the goal with surgery and to align things properly.
The ankle joint, I feel, in orthopedics kind of gets an overlooking. It's an easy joint. The ankle joint is not an easy joint at all. And what we know is 1 millimeter of displacement with the ankle joint, when how it rocks back and forth, increases the pressure on that ankle over 50% for each additional millimeter.
And how big is, okay, we're inches?
A millimeter is a little bit thicker than your fingernail. So that's the stuff that we're looking at.
The depth of my fingernail, so it's just no distance
It's very
at all.
minimal.
Yeah, the tolerance is, it doesn't take much.
Wow.
And so if you have a bad ankle fracture, even a bad ankle sprain, and all those ligaments are torn or the bone's torn, and that ankle is rattling around, you'll have a disfigured ankle in a year, like a leg that you can't even put in a shoe anymore. So these are things that we take very seriously.
Very important. And I hear that hurting feet and ankles is a real problem as people get old, because they've just had so much wear and tear on them that if they don't take care of them all along, it'll really impact their quality of life as they get older.
Absolutely.
Yes.
Okay, another
I have a
question.
question.
Another call, yes. Okay.
This is a female viewer, and she said she has a pea-sized cyst, and I think it's been diagnosed that it is a cyst. She said she cannot afford to be off her feet. Whoever she went to, she wouldn't call his name, call their name. 6 weeks recovery off her feet. She said she can't do that.
So the question
But she
was,
says it is hurting now. It hadn't been in the past. She said it started hurting.
very good. The question was, the viewer that called in has a cyst that's about the size of a pea. Did they say where the cyst was?
She said on the side of her heel.
On the side of her heel, and it's now painful, and was seen by another provider that mentioned if they had surgery it would take about 6 weeks of recovery, and it wasn't going to work into their lifestyle to be off that long. Anytime you have surgery, it can be a big inconvenience, and we as orthopedists recognize that. We try to minimize that to the best of our abilities. But the cyst, the question is, well, what kind of cyst is it? Common cysts that we see are ganglion cysts in the foot and ankle. So that would be kind of my first thought, is it's probably a ganglion cyst. Now, we can't just look at you and say, well, that's what it is. Many times we do further imaging studies, including an MRI scan, to help us determine what that is, or if it's anything more serious to worry about. Oftentimes it's not, but we don't want to just guess. Guessing gets you into trouble.
Yeah. So, again, let's just say it is a ganglion cyst of the ankle. What could you do for that non-operatively?
Yeah, a ganglion cyst, again, is very common. So some things you could try in the office. You could try a procedure in office where you would either aspirate the fluid from the cyst, followed potentially by a little bit of steroid. You could try a procedure where you kind of poke it with the needle, called fenestrating the cyst, to try to get it to decompress and hopefully scar in and not come back. With cysts, and even if you have it surgically removed or an in-office procedure, there's a chance it comes back, because it's sometimes hard to make sure you've removed all of the cystic material.
Okay, let's take a break, and we'll be right back.
Thank you.
Stay with us.
else I'd ever seen. He's compassionate. He really cares about his patients. I told him, you were my guardian angel. My experience with Nash was A+. I said, any surgery I need here on out, give me a blank piece of paper, I'll sign it. I want you to do it.
Learn more at nashsurgery.com.
We're in our 18th year of practice at the Hammer Chiropractic Center, and we've seen over 15,000 different people in the Rocky Mount area. 40% of headaches actually come from a neck problem. Many patients come in taking multiple aspirin, over-the-counter medications and such a day, and we can get you to stop doing that and actually fix the problem so the headaches don't rise anymore. A lot of people think chiropractic hurts. It does not. Most of the people come in and they feel great when they leave.
If you want fine dining that goes beyond just eating, come to Lily Ann Steakhouse. It's an experience. Exceptional food prepared by our famous chef, meticulous service, and upscale ambiance. Certified Angus beef, choice and prime, seafood, pork, and chicken, all seasoned to perfection. Book your private function with us, birthday parties, or any special occasion, or even meetings for your company or civic group. Lily Ann Steakhouse, located at 139 Gateway Boulevard, open Monday to Thursday 4 to 10, and Friday and Saturday 4 to 11.
So Vince Keeney, a physician assistant, is back. For those of you who knew him when he was here before, Dr. Kempker, y'all worked hard. People were asking when he's coming back all the time, right?
Exactly.
And your knowledge about ankles and feet and whatnot are really a nice addition
Thank
to
you.
Carolina Regional Orthopedics. So you want to wrap up anything about ankles before we go to feet, or you want to go on straight to feet?
I think we can move straight to feet and summarize a little more at the end.
Okay, and again, if you've got questions, we've had 2 questions already. 252-407-1111. He is happy to answer, or both of them
Give us
are
a call.
happy to answer your questions.
Both
So-
were great questions.
Yeah, they are. Okay. Feet.
So, foot problems. Along with ankle comes the foot. And so people are on their feet all day, whether they're working, playing with their children. It's very, very common to have a pain in your foot. So people come on in all the time and they ask us, well, what's going on? I've had this pain in my foot. Can it be looked at? Should it be looked at? Well, the answer is yeah. If it's been there and it's persistent, you should come on in and let us look at it, because there might be something we can talk about that will help your problem go away or ease the pain, and provide a solution that is amendable to each patient.
And foot pain can really mess up somebody's quality of life.
Absolutely.
Hugely. Plantar fasciitis is one of the first ones you have, and I know a lot of people who've had that. What do you recommend?
It's very common. I see that on a daily basis, it feels like, and sometimes many times. And most of these people are workers or in an aging population, and they'll have pain that's kind of near the heel on the bottom of their foot or extending into their arch. And it can be because of a tightness that develops in a connective tissue in the foot. And the problem with that connective tissue is it doesn't like to stretch very easily. And again, it is something that you have to stretch, have to stretch, have to stretch. But in addition to the stretching, which I can give you information about, are orthotics that can help with good foot posture, gel heel cups that will help ease some of the pain you're having or allow you to work with less pain. Occasionally we inject it, although that is not something I usually jump to on the initial visit, because many people don't need it if they are consistent with the stretching.
Is it caused by not stretching, or just by getting older, or what causes it?
It often just happens, but we do see it in an aging population.
Okay. Okay.
And you can actually frequently see it if you have, for instance, like a knee replacement or another leg injury. Or so, like, let's say you're an athlete and you tear your ACL and then you try to get back to sport. It's not uncommon for the rest of those ligaments and tendons in your foot to have been overlooked. Mm-hmm. And how many times do you see people after injury or after surgery that then get plantar fasciitis just because they haven't been stretching, using their foot, and now they're really getting back to injury?
Absolutely. If they haven't been able to use their foot or ankle as a result of the surgery or another condition, they might have that natural tightness because of their immobility.
Mm-hmm. You know what this brings to mind to me? Athletes always need to stretch well. I mean, they talk about stretching before you start exercising, but this is another reason why it's really important, isn't it?
Absolutely, and that goes again with the ankles and as well for the feet. It really is important to stretch before and after you're done with your exercise.
Okay, bunions and hammer toes.
We do see bunions and hammer toes that come into our office. We do some initial treatment for those that are kind of a newer problem that they're dealing with, and that may look like a toe spacer, but it's not always a bunion. Sometimes it could be arthritis of the great toe joint. So somebody might say, well, I think I have a bunion. And then they come in and we determine with an x-ray that it's not just a bunion. They have a problem called hallux rigidus where the joint gets stiff, it gets arthritic. And so having a surgery might not be something you want to jump to for that. And we could do an injection or talk about wearing a type of orthotic, or I call it a carbon fiber insert that makes your shoe stiff, so every time you take a step and you're not bending that toe where it hurts.
That's such a good point, Vince. In my foot and ankle rotation, you get the x-ray out, and the patient would have just horrific bunions on both their feet. And you'd go in there and you'd think you'd be talking about doing a bunion surgery on them, or the spacers, or specific shoe wear. And like, no, I hurt like right here. I hurt here. And you're like, oh, well, that's midfoot arthritis, or that is a impending fracture from osteopenia. So to Vince's point, if you think your bunion hurts, you need to get that checked out, absolutely, because there's many times it's something else other than the bunion.
Yeah, we often find too that our patients may be misinformed or don't fully understand what a bunion is. And a bunion is a deformity of the great toe joint. So you may have one, but they don't always hurt. I'd say many people have a bunion that don't hurt. My wife's one of them. She might not like that I'm telling on her, but they don't hurt her. And so my philosophy, if it doesn't hurt and it's a bunion, I would not do anything for it. But if you do have something that's painful.
What if you want to wear cute shoes, though?
If you want to wear cute shoes, I suppose, but that's not always a good reason to have surgery, just for cute shoes.
Right. Oh, I agree. I was just teasing.
Yeah.
Okay, flat feet and high arches.
Flat feet and high arches, yeah. And sometimes that goes with plantar fasciitis, the shape of your foot. And sometimes you're born with that shape of your foot, and you might have what we call a congenital flat foot, meaning you were born that way. Some people can acquire that with age from ligaments that become loose over time, or perhaps maybe they've had a trauma that caused that ligament to become unstable, and they'll have a collapse in their arch. We do see that as a result of many injuries in the foot, especially in the midfoot.
Do you help them get arch supports?
That's a great question. We do. We often try to start with something over the counter. Many people will do well with an over the counter type of insert or arch support, and I can guide them into some that I feel have worked well for me. But if they need something more complex or something more specialized, there is custom inserts that can be made, and there's a gentleman, as we've mentioned before, that can come to your home, size you, fit you, and make sure it's appropriate. And even with custom, adjustments may need to be made after you've worn it for a month or so, and he can come back and adjust them.
I always bring all my custom braces back because sure enough, there's always something that you have to sand down, shim down, modify just a little bit, and get it back with the orthotist or the prosthetist. And the patients like it, the prosthetist, the orthotist like it, because they want to put out a good product. They also want to make you feel better. So,
absolutely.
If somebody, a question. Oh.
Do you handle diabetic neuropathy in the feet?
So it would be good to have an evaluation.
Okay, tell what the question is.
Oh, great, thank you, sorry. The question was, do we handle diabetic neuropathy? I would say yes, we do, because again, it might not be diabetic neuropathy, and getting more information from an evaluation and an exam with us is important. So not every problem is what you think it is, and so yes, I would say come on and have us evaluate it to determine if that's in fact what it is.
And diabetic neuropathy in and of itself is a very difficult problem. Diabetes in and of itself can give you something called a Charcot joint, which is probably a little bit more than this, but that's something that you should absolutely, if you think you have diabetic neuropathy, you should absolutely get it checked out by a professional, because your bones could be deteriorating on the inside, right?
Absolutely.
And that's one of the things that you really need to check out. You also need to have foot care set up with a provider with the correct shoes so you're not getting sores. You have to have people talk to you about where you're insensate. There are some medications that are okay for diabetic foot pain. We don't really do a whole lot of the diabetic foot pain per se, but you want to have someone who's a bone, ankle, foot specialist to look at it, because there are other things with diabetic neuropathy that can really tear your foot apart.
And in addition to the neuropathy and not being able to feel appropriately or normally in your foot,
Which is what the neuropathy is.
which is the neuropathy, can lead to developing wounds, and that is absolutely not something you want to ignore. It could lead to a bone infection, which could lead to an amputation of a digit or a foot, or worse, part of your leg. So on that note, it would be good to have that wound evaluated, which we have a wonderful gal, Van Tria Gross. She's a PA at our practice that handles our wound care and does a marvelous job for diabetic wounds.
So if you think you're getting diabetic neuropathy, please call us. We'll get you in, we'll get you evaluated. It may be an appointment that you might say, I'm going to feel silly going there. It will not be a silly appointment, because we're going to be looking for stuff, even if there's like minimal prescriptions, minimal pain medicines. What we're doing is we're trying to make sure that your ankle's safe, your foot's safe, so that you don't have those horrific complications that Vince just talked about.
Absolutely.
I had somebody tell me one time that somebody's diabetic foot problems was so bad that they could stick a pencil through their foot.
Yeah, you don't want to get there.
So, I mean, the early intervention, or to the extent that you can stay on top of it, is extremely important, isn't it?
Yes.
I mean, what we talk about people's A1Cs daily,
Yes, every day.
every day.
I want to go back to flat feet and high arches. If people don't have proper arches, then their whole body alignment isn't right, and that can mess up things besides their feet, can it?
Well, it affects our gait and how we walk, which our gait is how we walk, and so that can lead to throwing off your balance. It can lead to how your knees and hips and back feel. I'll give you a little story. I've treated many people with ankle fractures or ankle injuries, and I'll often put them in a boot. And that boot is pretty high in comparison to their normal shoes, and so they kind of walk uneven, right? The problem with that is that often leads to a hip. They'll come in and they'll say, Vince, my hip hurts, or that caused my back to start hurting, and it wasn't hurting like that before. And so, yes, it does affect our gait and affects our other body parts, and it's important for us to pay attention to that. With the boot, so I just kind of solve that or finish that thought, is that there's a device that we can put on the other side of the foot to even you up back to the level of the boot, so you're walking more normally. But with high arches or flat feet, it's good to have good foot posture, especially if you're on your feet all day. Having a good pair of shoes and changing them regularly because they wear out. It's kind of like the tires on your car. You wouldn't want to run them till they're bald, because then they're no longer serving the purpose. For our shoes, the cushion and the sole of it is important for how our feet feel. For people that are waiting tables, working on their feet on concrete, which we have a lot of that around here.
Concrete's really tough.
I hear that regularly.
all day. Yeah.
If someone comes in for a foot or ankle problem and it wasn't an injury, most of them will say either I am working on concrete or I did. It's very common.
Well, and heavily cushioned shoes can help with that some, right?
A good cushion and even just an over-the-counter orthotic that you're changing out regularly. You might not need to get a new pair of work boots every 3 months, but maybe once or twice a year if you're wearing them regularly.
And an actual support, right? The arch of your foot is a perfectly made arch, and if you don't support the arch, it will fall down to give you that flat foot. And sometimes that arch is falling down, it hurts. So what Vince was saying is that's whenever we actually maybe not give you a new shoe, maybe the over-the-counter stuff isn't working for you, that's when you want to see us, because there's either little orthotics that we could put into the shoe for the flat foot, or sometimes even have to include ankle orthotics into it. And all those things can actually make you hurt less when you're standing on that concrete.
Ankle orthotics, what do they look like?
That's a great question. There are various types of ankle orthotics out there. We'll jump back to the ankle for just a minute, but for people that have a complex deformity of their ankle or severe ankle arthritis, there's various devices that can be used to be worn in their shoe that help limit or restrict movement, which hopefully limits and restricts how much pain you're having.
Oh, okay.
They look sometimes like a custom sock that are molded. These are typically custom that are just for that person. They can't be given to you know, your brother or sister. And a lot of them are to be designed to wear in the shoe or outside of the shoe.
Yep. Most of them now are like a custom, it almost looks like a fiberglass, but it's a plastic that forms and holds your foot up in place, and it kind of goes underneath the foot and then kind of cups around the sides of the ankle to help with a flat foot or a high arch, just to kind of give it a little bit of a break from holding all your body weight up whenever you're walking around.
And stability. One last thing before we take another break, stress fractures.
Stress fractures is another common thing we see. I would say the more aging population, those that are dealing with osteopenia or osteoporosis, so the quality of their bone is diminishing as they age, or from maybe medications or from smoking. But stress fractures are very common. We also see them in athletes. So they'll come in and complain of pain in their foot, not from an injury typically. I didn't fall, nothing hit it, nobody stepped on it, and we'll get an x-ray. Not always when you get an x-ray will you see the stress fracture if it's perfectly lined up. But it's still important to come in and see us, because our clinical suspicion will be to determine that this is possibly a stress fracture. And oftentimes, if I suspect it, I'll treat it as one. They'll come back in 6 weeks or 4 weeks and I'll get an x-ray, and it turns out the bone's starting to heal because they had a stress fracture.
And you can see the healing?
You can see the healing at that
Interesting.
point.
And I mean, how many times do you have somebody with osteoporosis and they come and they tell you they have osteoporosis and they point to the top of their foot and they say, I hurt right here.
It is.
And it's
very
like,
common.
It's so common, and so many people just don't know what it is.
Yes.
That they just try the over-the-counter like medicines and creams, and sometimes you need someone to take a look at it to actually get you going down the right path to get you to feel better.
And not just the people with osteoporosis, but I mentioned athletes. If you're an avid runner and you have high mileage, I wouldn't ignore your foot pain. It's probably not just because you're running, you know, so much each week. It's probably because there's an underlying stress fracture.
And dancers, man,
Dancers as
is
well.
the worst stress fractures.
Like professional dancers or just
All kinds.
people like to dance around here that like,
Oh yeah, all kinds of dancers, ballet, any kind of dancing.
okay. Well, it's time for another break. Think about questions that you have. Again, 407-252-407-1111. We've had some great questions, so feel free to call in, and we'd love for these gentlemen, these experts, to answer your questions. So we'll be right back.
When Jay arrived at the emergency department with a hernia, he was in pain, scared, and unsure of what would happen next. That's when he met Dr. Clarice Monnier.
The way she conveyed, it was something that I could understand. She didn't talk over my head. She called me at home on her cell phone just to see how I was doing. They really treated me like family. I just can't say enough. I wouldn't be hesitant to come back here.
Learn more at nashsurgery.com.
When faced with special care needs for elderly or disabled loved ones, families want compassionate, comforting care. That's Tender Touch Home Care Services' goal, providing the level of care we would expect for our own. With over 10 years of home care excellence, Tender Touch provides an array of services that keeps your loved one at home. From personal care, light housekeeping, errands, and meal preparation, to our private duty care program, which combines all of our home care offerings in one package.
Tender Touch Home Care Services, where your needs are our concern.
What is Celebrate Recovery? It's a Christ-centered, faith-based recovery program for anyone dealing with life's hurts, habits, and hang-ups. Celebrate Recovery meets every Thursday night at 7 p.m. at Farmington Heights Church in the Wilson, Raleigh, and surrounding areas. Please join us every Thursday night at 7 p.m.
And we're back. I hope you've thought of some good questions while we're gone. And you gentlemen, we're coming up with all these terms, neuromas and all these other things I've never heard of that we're going to talk about. So as you go through them, please tell us what they are, please.
So there's several things that people talk about when they come in to see us involving the bottom of their foot. And that's a very common complaint, as we've talked about with plantar fasciitis, but there are others that are important to mention. People can come in and they'll come in with pain near the ball of their foot, kind of near the front of the foot on the bottom. So if we use this model, it'll be along the bottom near their toes. Kind of where the toes meet the foot.
Like sharp pain? Or?
Achy pain that after they've been standing for long periods of time. Pain when they walk barefoot is a common complaint.
I always get feels like I'm standing on marbles.
Feels like I'm standing on marble is a great one, or a little pebble, or there's something in my sock, but there's nothing actually there. So we hear that very commonly, and so there's some things that it could be. There's a term called a neuroma, where you get a thickened and irritated nerve in between a couple of the bones, most commonly in the second and third web spaces of the foot, excuse me, and that can be quite painful. And that nerve has this inflammation, the blood vessels around it are irritated, and so they complain of this pain.
It's like, imagine a pinched nerve in your back, but it's just a pinched nerve in your foot.
What can you do about it?
That's a great question. Come in and see me, because you might be a candidate for an injection or wearing a certain type of pad temporarily in your shoe to offload the pressure in that area to hopefully calm down the pain you're having.
You don't ever sever a nerve, do you?
I wouldn't do that in the office, but that's a great question, because if you have a nerve that's not responding, such as a neuroma, to an injection and all of these conservative management options, there is a procedure where you can have that neuroma removed.
That's good, because I would hate to think if they didn't, there was nothing that could be done.
Nobody wants to deal with it the rest of their life if they can avoid it or get some type of relief.
Okay, calluses, corns, those type of things. There are a bunch of, almost everybody gets, at some point, gets some of them, don't they?
Absolutely. So somebody might develop a thickened, painful spot on the bottom of their foot. They might be someone that is active or just aging, and they develop this area from extra stress or pressure, clogged pores and just sweaty feet, and they can develop these areas that become painful. And that is something you can come in to be evaluated, make sure there's no structural reason for developing it, which does occur, whether you have a deformity or some trauma. But if you develop a corn or a callus and it's painful, we can take care of that in the office with a simple procedure where we pare or shave down some of that skin until they get the relief.
And similar to the cyst question, you need to make sure that what you have on your foot is actually a corn, right? Because there are other things that could be down there, like an infection or something, like
or a wart, a plantar wart.
Yep. So those are some things. If you think you got some corns, it's not something they should just be always taken care of at home. You need somebody to look at it.
And if you start doing that to yourself, you might make the problem a lot worse if you try to fix it yourself.
Absolutely. If you're diabetic and you have these, you really shouldn't be doing this at home to yourself or letting someone do it to you that is not a professional. Because if you develop an infection or develop a wound, that can be a slow healing, very long process to be dealing with, that can turn into something more problematic, like an amputation.
I want to go back to ankles and talk about injections. You referenced injections a number of times, but steroid injections in your feet and ankles, I guess.
Yeah, I do in-office injections for the feet and ankle on a regular basis. It's very common and often helps with alleviating the patient's pain for a period of time. With arthritis, there really isn't a cure, and so the goal is to try to control their symptoms with the expectation that eventually it's going to return.
What does the steroid do? Just shrink the swelling, or what?
The steroid treats the inflammation that's happening within that joint, which in turn, when we're treating the inflammation, we are helping with swelling, we are helping with pain, and sometimes with the stiffness. That can vary depending on how bad the arthritis actually is.
And I do have to say that whenever I started, right after Vince left, everybody asked, when is Vince coming back? Because he gives the best injections. I heard it for years.
Oh, you do?
Now he's back.
How do you do that? Because I've had some that I wanted to just levitate to the ceiling.
I do it with love and care. I don't know if I have any special advice to those out there wanting to know how I do them, but
You don't want to give away your secret, do you?
I probably shouldn't. Just come see me.
That's quite a compliment, though.
Thank
I
you.
mean, I think most people who've had a steroid shot can share a horror story with you.
Especially in the feet.
Yeah.
Yeah.
Yeah. Or even the ankles or the hands.
Yep.
I mean, there are lots of places that it's been good for you for
thank you.
caring enough about people to.
In addition to the injections, we probably should mention too that that's definitely not your only option. There's medications. There's some supplemental things you might do over the counter.
Topical or internal or what?
Both, in
By
fact. I often recommend both, depending on the patient's preference or what they have tried in the past that either did or didn't work. That can sometimes guide my approach to what I recommend.
And when would you put in a new joint, like for the arthritic joint for the big toe and the foot?
So for the foot or the ankle, these are
ankle too,
these
yeah.
are joints where they're extremely arthritic and they've failed or exhausted all of the conservative measures, the injections, the therapies, medications, and the over-the-counter options, orthotics, etc. So we would evaluate them, and if I've brought them to that point where they are no longer receiving any benefit from that, it might be something we refer to an orthopedic surgeon that can handle their problem.
I have heard that an ankle replacement or ankle surgery is really, really tough. And have you seen really successful ankle surgery in your practice?
Not in this particular practice. We don't have anybody currently doing ankle replacements.
Plenty of fractures and
a lot of fractures we manage here.
Everything but replacement, in essence.
But to answer your question, I have. I spent many years in Montana working for a very successful and professional orthopedic foot and ankle surgeon who was fellowship trained. He did a fantastic job, and we did many replacements that people were very satisfied with.
Because I've heard that's just a really difficult one to do.
The procedure itself, I would say, is a challenging procedure, but the goal is to restore that patient's anatomy to the ability where they can function in life, they can have an ability to exercise within reason, and enjoy a good quality of life, which is important.
And as Dr. Kempker said, physical therapy immediately is crucial.
it's crucial.
Do we have another question?
Question.
Wonderful.
This lady just tuned in. She said she didn't know if you had discussed bunions, but how painful is the surgery? And she said, is it a female problem?
So the question is, do we handle bunions? The viewer just tuned in and had not heard our discussion a little bit earlier, but I'm glad you called in because that is a good question. They wanted to know, is it a painful procedure to have your bunion corrected, and is it just a female problem? The answer is, to the first part, is it's not a female problem directly. We probably do see a few more females to male ratio, but it's non-discriminatory. It can happen to anybody. Some people are born with them, they have a congenital bunion, and some people have developed it later in life.
Is it genetic? I mean, if your mom had them, you're probably going to have them too?
Sometimes, yeah. It can show up at birth, and I have a niece who was born with bunions.
A baby.
My wife has had them her whole entire life, and as I mentioned earlier, not painful. But when they become painful, and if you have surgery for it, there's a great procedure out now. It's a minimally invasive bunion surgery. We don't offer that at our practice right now because, again, we don't have an ankle or foot specialist that's doing that. But I can refer you to those that are handling that problem with that particular procedure because the recovery isn't as bad as it used to be for other methods of correcting your bunion. So that's a great question.
Do tight shoes contribute to it?
I think footwear, there's probably some relationship.
Stiletto heels.
There's some relationship to that. I probably see more Achilles issues with the stilettos, but footwear does affect it. You don't want a shoe that's ill-fitting and improper for the shape of your foot. Some shoe stores back in the old days, would actually sit you down, they would see if the shoe fits and walk you around the store like my mom used to do to make sure it was a good shoe. Unfortunately, most people are getting their shoes online or not really taking the time to see if they fit before they get them. And so I would suggest, you know, trying your shoe out before you buy it.
But high heels put one's foot in a position that they weren't supposed to be in, basically, right?
Well, for a prolonged period of time, yes. Okay. Those high-heeled shoes or wedge shoes, if you wear them daily, you can develop an issue with your Achilles where it becomes too tight, and you might develop something we call a contracture, where that Achilles won't stretch out or lengthen the way it's supposed to.
I'm going to tell you something. My uncle, way long time ago, and they got rid of them, but he had, in fact, there was somebody locally who had in a shoe shop where you put your feet in and you press something and you have x-rays and you could see where your feet are.
I've seen those machines. They're how long ago was that, man?
Long time ago.
It's a neat shoe.
Yeah.
I think there was a lot of radiation, so they decided not to do that.
The Keel family locally, which a lot of people might know about. Is there another question? No, you're just staying here. Okay.
Yeah.
But yeah, that's not x-ray that anybody needs to have on a regular basis.
No, yeah, I would avoid unnecessary x-rays for sure.
Okay. What else might we want to? Visible deformities.
Yeah, you know, we mentioned cysts before, but sometimes people will come in and they have a hard bump on usually the midfoot or sometimes the back of the heel that they can feel, and it feels very firm, hard. It's not always a cyst, like we talked about earlier. Sometimes it's a bone spur. Those bone spurs sometimes can become painful and are usually a sign of something more problematic underlying, like an arthritis that has developed. People will develop bone spurs in the back of their heel that can become painful when they walk because the Achilles tendon is attaching there, or their shoe rubs on the back of that and it's too tight, and so that can be an issue for patients.
What age people do you see?
That's a really great question. I see all ages.
Children,
I see little children that have injuries. If they're born with a deformity or a defect, I think a more appropriate choice would be to go to a pediatric orthopedist. But I do see injuries that occur from a fall, or if they trip, and I see to the end of life.
We get little children though who have feet problems that are sometimes missed or overlooked by the earlier stages of their life. You definitely still want to get your child evaluated for if you think their foot is.
We won't turn you away. Yeah. We would definitely direct you to somebody that can help you with that.
And that is sometimes the most valuable thing you can do, is just get back on the right path so you can get your problem corrected.
I hope more than anything this show will help people think if they have pain, if they've got something different on their feet, there is help. And the sooner you get it addressed, the better. But a lot of people in this area, I think, live with pain that they don't have to live with. And if they come in to be evaluated, and y'all take insurance and whatnot, and it doesn't mean you're going to have surgery, because as they said, they will try to avoid surgery and fix it without that. But people just don't need to sit at home and suffer, do they?
No, orthopedics, again, from my perspective, is to try to provide a great quality of life for my patients. And that means guiding the level of care to their needs and making it more individualized. So I would agree. I want them to come in and get it looked at, so you know that there's somebody that cares about you, that wants the same things you want for yourself, and wants to hopefully improve that situation. And if it ever gets complicated, we know what to do.
The one thing that drew me to orthopedics, and I still love about orthopedics, is we are the only specialty, maybe neurosurgery, which is a branch of orthopedics at this point, where you come in and we actually can make you better, right? We can make your gait better. We can make your daily function better. Not many other doctors actually offer that. Most other physicians, and I know I'm gonna have my friends yelling at me for this, you're kind of taking a sickness and making them a little bit better or not getting worse. But orthopedics, we can, if you're having chronic pain, chronic deformity, you need to go get it checked out.
And the earlier, the sooner, the better.
Correct.
For the outcome, right?
Correct.
Yeah, you don't want to ignore things that can be improved upon or stop the progression of. Not always is that possible, but at least knowing that is helpful.
What type of shoes? I hadn't looked to see what you have on. I'm looking right now. Can you give us some advice for what types of shoes are best for our foot health?
That's a great question. I get that regularly as well. My response typically would start with, well, you need to wear the appropriate shoe for the activity that you're doing. You don't want to go work at the mill wearing Crocs. You don't want to wear Crocs when you're going to be in a wet or dirty environment because they have holes. So you would want to wear the appropriate shoe. Another example is I wouldn't wear my dress shoes that I'm wearing in the office while I go work out and spend time at the gym. And so that to me is important. So I kind of ask my patients, well, what activities are you doing? You know, what seems the most appropriate? There's several different options for shoes, and it's not always the most expensive option that is the right option for you. I think that's a misconception that people get. Just because it's expensive, it's going to work. It doesn't always.
And if you put on a shoe and it hurts you, I think the days that I just need to break that shoe in are pretty much over. The break the shoe in used to be like the cowboy boots and the work boots, right? I guess maybe some of the custom cowboy boots, there is a wear-in phase. But the work boots, when I used to work in construction, if they're not comfortable right away, especially with the steel toe ones, those can really get your foot in a bad place. So make sure you're wearing comfortable shoes pretty much as soon as they're out of the box.
You don't want to have to buy those the shoe stretchers. I mean, if they don't fit right up front, then you don't need to.
Those good old shoe stretchers.
Need to be back. Toenails. If people don't properly cut their toenails, that can impact their foot health too, can it?
It absolutely can. We commonly hear about people that have an ingrown toenail, and that often, it usually starts from them improperly cutting their toe. You might not have ever thought about, is there a right or a wrong way to cut the toenail? If it's too long, just trim it. You want to trim your toenails straight across.
You don't want to have a
You don't want a curve to it, absolutely. That can lead to that toenail wanting to grow underneath the skin, which will start with pain, and then that pain gets really severe to the point where it's digging in, it's getting inflamed, and it hurts, and then it can turn into an infection, which is a problem we want to avoid. I can help you with in-office ways to help with that, and again, we want to try to avoid surgery, but sometimes there are surgical procedures that may be recommended for a chronic ingrown toenail.
So as people are listening, if they think, well, I've been putting this off long enough, how long does it take to get in to see you?
That's a great question. I like to tell people that I'm very available. If you call in, I can see you a lot of times that day. I could see you in a couple of days. I'm very flexible with your schedule. We have great hours where we can see you a lot of times before work, or we stay open a little later, which could allow people to come in after normal business hours for most people.
Of course, the urgent care too, if you're injured during the day.
Yes, urgent care is a wonderful thing to come in if you have an on-the-job injury, or your child has an injury where they fell at recess, or just didn't have time to get to it last week.
Were you going to say something?
I was going to say the urgent care is a wonderful way to come in.
Oh, yeah.
If you have something that you did yesterday, right, like you were at work and you twisted your ankle.
Yes.
You thought it was going to get better. It didn't get better. That's an absolute urgent care scenario. We won't. It's people. I think, oh, I just twisted my foot. They're going to shoo poo me away. No, we're going to get you in because, like we've talked about for the past hour, there's some serious foot things that can happen with what seems like a simple ankle sprain.
It's undiagnosed. And if you forget Vincent Keeney, just call and say the PA who's the foot expert, right? Who gives good steroid shots.
That's right. And just to mention too, I do love foot and ankle things, foot and ankle problems within our patients, but I do treat other conditions, and I've done that for many years. I treat shoulders, hips, knees. Again, as we started with, I work with Dr. Kempker in the OR. So I see a lot of general orthopedic conditions, but I truly do love what I do.
Thank you for coming back to Rocky Mount.
Thank you for having me.
We really do appreciate it. Dr. Kempker, thank you, and I assume in a few weeks we'll have another.
Yep, I'm going to try to twist my other PA, get her in here.
Okay, sounds great. Well, thank you, and thank you so much for joining us tonight. And this is going to be on YouTube if you want to replay some of it, or if you joined in late. But gosh, if you got anything wrong with your feet and ankles or anything orthopedic, don't suffer, get help, and have a good day.